Hello class. Today we are going to be talking about the bladder and we are going to be talking about urine. Now, your bladder is one of the simplest organs in the human body. It is effectively just a hollow sac that is used to store urine until it is full, and then it will excrete that urine through muscular contractions outside of your body. Now, the bladder does have muscular walls, and it is quite flexible in that when it fills, it stretches, and your bladder can hold about 400 to 600 milliliters of urine for up to about 5 hours. And the muscle in your bladder wall is called the detrusor muscle. And the detrusor muscle relaxes to allow your bladder to fill, but when you go to the toilet, when you go number one, your muscles are contracting and forcing that urine outside of your body. I will be posting a couple videos on my website. I recommend you check them out. One is on why your urine is yellow. It does, again, have to deal with the breakdown product of hemoglobin. And another one will be on just general hydration and how you can tell your levels of hydration based on your urine. Both urinary output as well as color. Now, there are a couple sphincters associated with excretion of this urine. And if you don't remember what a sphincter is, it's that ring of muscle. When it's contracted, it's closed. When it's relaxed, it's open. Now, there are two sphincter mechanisms. There is an internal sphincter at the neck of the bladder, and your body opens and shuts it automatically without you thinking about it, right? It's under autonomic nervous control. Now, the internal urethral sphincter is smooth muscle. It's involuntary controlled. More superior located, aka it's closer to your head, right? It's the one right at the junction between your bladder and your urethra. Now, the external sphincter acts like a tap and keeps the urine in the bladder. It is controlled by the pudendal nerve, I probably butchered that pronunciation, which is controlled by the voluntary nervous system. Obviously, you want to be able to control when you go to the washroom. For your survival, for our species' survival back in the day, you wouldn't want to have to just spontaneously urinate when you are being chased by a lion. So we do have control over that sphincter, and we can open it when we have the urge to urinate. Now, you decide when to let it open, and the external sphincter is also called the distal sphincter. And instead of that smooth muscle, which is involuntarily controlled, this is skeletal muscle. Now it's voluntarily controlled, and it's located further down than your internal urethral sphincter. So how do you know when to empty your bladder? This is called the micturition reflex. And what happens is, about 4 to 8 times a day, depending on your fluid intake, depending on the size of your bladder. One of the genetic curses of the salt line is we actually have pretty small bladders, which means that frequent urination, especially as I age, is going to be an issue. Now, the reflex is controlled by your central nervous system. When your bladder is about half full, you have stretch receptors on the bladder walls that will then send signals along your pelvic nerves to your spinal cord, and a reflex signal is sent back to your bladder to make the detrusor muscles contract. The contraction increases the pressure in your bladder, and this is what makes you want to pass urine. That's when you get that sensation like, oh, it's time to go to the washroom. Now, because the external sphincter is under voluntary control, you don't urinate until you decide to relax this muscle. But as soon as that pressure builds up, it's time for you to urinate, you will get that sensation. Alright, so let's now talk about the main hormones. I talked quite a bit about ADH already, but there is another important hormone involved as well. Just a refresher, antidiuretic hormone, this is another negative feedback loop. What's going to happen if your water balance in your body is low, if you are dehydrated? Well, in that situation, you are going to be releasing a lot of antidiuretic hormone. I simplified this a bit yesterday. The pituitary gland is actually releasing the ADH. The hypothalamus is your detector that detects the fluid volume of the body. And this ADH will cause the translocation of aquaporins into the collecting duct membranes, which allows osmosis to happen, right? So you get more water reabsorbed from the urine as it passes through that extremely high osmolarity medulla, right? That really salty medulla. As there's more aquaporins, this allows more of that water to passively diffuse out, and thus you reabsorb more water from your urine. On the flip side, if you are chugging water back, this signals your body to not release ADH, and thus your urinary output will increase as you are absorbing less water from that urine as it goes down the collecting duct. Right? So ADH is very important for maintaining fluid balance in the body. Aldosterone is another hormone that's very important for balance, but this is more so for blood pressure balance. So when your blood pressure drops, it's usually due to the level of sodium in the blood falling, and when this happens, your kidneys release renin. So it's actually, renin causes the adrenal gland to release the hormone aldosterone, and aldosterone promotes the reabsorption of sodium. It also causes blood vessels to constrict, and right, if you decrease the diameter of your blood vessels, you are going to increase blood pressure, and you also get the sensation of thirst. So all of these things are associated with aldosterone, right? You get blood pressure increasing due to vasoconstriction. You get more reabsorption in your kidneys more reabsorption in your kidneys of that sodium, and you feel thirst, promoting you to intake more fluids. And all of this will cause your blood pressure to increase. Now, when your blood pressure and sodium concentration are back to normal levels, your kidney stops secreting renin, and thus aldosterone stops secreting as well. Keep in mind, with increased sodium reabsorption, you also get increased water absorption, right? The more sodium you remove from the filtrate, the lower the osmolarity of the filtrate, and thus the more water that can passively diffuse out. Let's talk about diuretics. Now, diuretics are important drugs in society in this day and age. If you have high blood pressure, usually you'll be prescribed a diuretic. Is often a very low side effect medication that you can take for high blood pressure. And what diuretics will do is they will increase your urinary output. Now, caffeinated beverages are considered diuretics. What they end up doing is the caffeine increases your blood pressure, which causes greater amounts of filtrate to leave the glomerulus, and thus increases your urinary output. Alcohol is another important one. Alcohol inhibits that ADH secretion, which means that you are going to have a ton of urinary output, and as a result, you are going to dehydrate yourself through urination. Right? That's what causes a hangover. Right? The alcohol inhibits ADH secretion. You no longer are able to reabsorb as much water as that urine passes down your collecting duct. Your urine, when you go to the bathroom, it's going to be very clear. You are literally peeing out your bodily fluids, and you will be very severely dehydrated the next day if you consume too much. Now, there are drugs that can act as diuretics. Like I said, blood pressure meds often are diuretics. And there are drugs that are anti-diuretics as well. Drugs that will cause you to hold on to more water. So let's talk about urine. Now, it's mainly water, to your surprise, I'm sure. So it is completely mainly water, and it usually contains urea, uric acid, creatine, which is a breakdown byproduct from creatine phosphate, which is used in muscles, kind of as another form of readily available energy, like ATP kind of. It may contain trace amounts of amino acids and varying amounts of electrolytes, mainly just a fancy word for your salts and sugars and stuff like that. And your volume varies with fluid intakes, obviously, right? The more you drink, the more output you'll have. The less you drink, the less output. It will vary with diuretics and with environmental factors. Clearly, if it's, you're in the middle of the desert, super dry, arid air, really hot out, well, that's going to dehydrate you pretty quickly. You're not going to urinate as much, right? Things like that. pH, usually around the 4.5 to 8 range. Average would be 6. On a vegetarian diet, your urine is more alkaline. And on a protein-rich and wheat diet, the urine is acidic, typically. But it usually just falls within this 4.5 to 8 range. And again, that pH of the blood being maintained is done in that last step in the distal convoluted tubule, right? We're secreting hydrogen ion in if our blood is acidic, or not really at all if our blood is alkaline. Color. The pigment is urochrome. It's a breakdown byproduct of hemoglobin. I think the actual, once it's finally broken down into its final stage, I think it's called urobilinin. I could be wrong about that, but I will post a video on it on my website. And it is affected by what we eat. Now, things like salty foods and vitamins can have an effect on the color. Beets and rhubarb can give it an actual pink or smoky color. Vitamins like vitamin C can make it a brighter yellow. And sometimes with infection, if you have a urinary tract infection, bladder infection, your urine can be quite cloudy. Dead cells, tissue, there's full bacteria. Take your pick. And the odor it's normal to be kind of like ammonia-like. No one likes the smell of urine. Yes, they do have a urine chart to determine whether or not you are hydrated or dehydrated. And if it's very clear you are hydrated, barring some sort of other medical condition, or maybe you're consuming alcohol, something like that. But in normal situations, if it is very clear, you are well hydrated, and the more yellow it becomes, the more dehydrated you are. And if your urine's looking like this, you are in trouble. You are in a bad spot. Either you have a medical condition or you are severely dehydrated. So let's talk about urine tests for a moment. A urinalysis is a group of chemical and microscopic tests. They can detect byproducts of normal and abnormal metabolism, cells, cellular fragments, bacteria, things like that in your urine. And this is important for assessing maybe you have metabolic disorders like diabetes, something like that. It could also be important for assessing infection or other abnormal kidney functions, which would allow things like, protein to be in higher concentration in the urine than expected, for example. Now, urine is produced by the kidneys, and the urine is generally yellow, is generally opaque, generally transparent, clear throughout. And each time someone urinates, the color, quantity, concentration, and content of the urine will be slightly different because your body's always trying to maintain homeostasis. So it's going to be different pretty much every time. However, it should fall within some boundaries. Now, many disorders can be diagnosed in their early stages by detecting abnormalities in the urine. These can include increased concentrations of constituents that are not usually found in significant quantities in the urine, such as glucose, proteins, bilirubin, red blood cells, white blood cells, crystals, and bacteria. Crystals could be indicative of the early signs of, bladder stones or something like that, kidney stones. So, if you find these things in high amounts, or in the case of blood cells, in any amount, it is cause for concern. If you find blood in your urine, that is cause for concern, and you should definitely seek immediate medical attention. Now, abnormalities that may be present can arise from things like elevated concentrations of the substance in the blood, right? Because your body's just trying to get rid of that excess. If you are severely diabetic and you haven't taken your insulin, well, now your blood cells don't have the ability to remove that sugar from your blood, and it builds up to extremely high levels. This obviously will cause super high blood pressure, a whole host of issues, and your kidneys will try to dump this excess sugar. Now, sometimes this buildup of things in the blood can be that your kidneys are failing, right? They become less effective at filtering, and they are failing as a result. An infection can also cause these things to happen, right? If you find large amounts of white blood cells in the urine, that could be indicative of infection. Now, these urinalysis tests, they can be used to detect, again, substances or cellular material in the urine associated with different metabolic or kidney disorders. And they can often, for substances such as protein or glucose, they will be used to detect things like, hey, we're going to see where your insulin levels are at because we're detecting high amounts of sugar in your urine, for example. Now, they can be used to detect urinary tract infections. Again, appear cloudy. Microscopy, you can see if there's bacteria, high amounts of white blood cells, all indications of UTIs. And in patients with acute or chronic conditions such as kidney disease, urinalysis may be ordered at intervals to help monitor organ function, to see if there's a further deterioration of the kidneys. Let's look at abnormal constituents of urine. First up is glucose. Right, we don't normally find glucose in the urine, so this could be an indication of a condition. Now, it could be just you've eaten a lot of sugar. If it's chronic, however, if we keep finding it in your urine, that's often not the case. This could be due to high levels of stress. But again, if it is chronic, we keep finding glucose in your urine, it could be an indication of diabetes. They'll check your insulin levels if you are having glucose found in your urine. Next up is albumins. Now, these are blood proteins. You normally do not find them in your urine because they are quite large. Now, if you do find them in your urine, this could be non-pathological, right? It could be something like excessive exertion. Working too hard could cause some protein to get inside the urine. It could be due to pregnancy or overabundance of protein intake. In terms of pathological conditions, this could be due to kidney trauma. You suffer maybe a blow. It could be due to heavy metal poisoning, and it can be due to some bacterial toxins. Now, they can have many interpretations, urinalysis tests, but generally the greater the concentration of an atypical substance, such as the amount of glucose or proteins or red blood cells, the more likely it is that there is a problem that needs to be addressed. Now, a normal test does not guarantee there is no illness. If you're chugging back a lot of water, it can dilute and hide that problem. So they are a good indicator, and that's usually what they are used for, not definitive proof. So usually they will offer up, hey, we're going to do some further testing to see if this is actually an issue. Now, unfortunately, your kidneys and your bladder do change with age. Your kidneys will lose function, as most of your body does as you age. Now, by age 80, the kidneys have lost about 1/3 of their mass. Now, this is mainly due to the loss of glomeruli, and obviously if you're losing glomeruli, you're losing those functional units of the kidney, and thus your kidney is less effective. Now, once you reach a certain age, you may develop proteinuria, finding protein in the urine. You may get, your renal tubules may thicken or harden, making it harder to reabsorb things. And it's harder for the kidneys to clear certain substances. And unfortunately, your bladder, ureters, and urethra will lose elasticity, and thus your bladder will hold less urine. That's why if you have older parents, you may find that they don't sleep through the entire night, right? They're waking up in the middle of the night to go to the bathroom because their bladder has now lost elasticity and thus fills up. Well, fills up sooner because it can't hold as much urine. Next class, we will be talking about excretory disorders and what we can do for those individuals that are suffering from kidney failure. Right on. Have a wonderful day, everyone.